Welcome back. In this session, we are going to discuss another homeopathic remedy called diphtherinum. It is a nosode which is prepared by trituration of diphtheritic membrane. You can see in the picture here the diphtheritic membrane. We are going to prepare the remedy with the use of the diphtheritic membrane by the process of trituration. Clinical indications of diphtherinum is croup. It is indicated in croup. So guys, what is croup? Tracheolaryngobronchitis is croup, where there is narrowing of the respiratory tract. You can see the narrowing of the airway and the swollen tissues in the respiratory infections. Croup is an infection of the upper respiratory airway. It is causing voice hoarseness and a barking cough will be produced in cases of croup. So the diphtherinum is indicated in croup. Diphtheria, where there is a false pseudomembrane formation. A false membrane is formed in the throat. Post diphtheritic paralysis. After the diphtheria, if the person lands up in paralysis, then we can think of diphtherinum. Epistaxis, the bleeding from the nose. Tonsillitis, the inflammation of the tonsils. Tonsillitis. Myelitis. So what is myelitis? The inflammation of the spinal cord. So these are the indications, clinical indications, clinical conditions where we can think of diphtherinum. What are those? Croup, diphtheria, post-diphtheritic paralysis, myelitis, tonsillitis and epistaxis. What is the constitutions of diphtherinum? Diphtherinum is adapted to scrofulous, soric or tuberculous person. So who are these scrofulous people? Who have a tendency for glandular affections. If there is glands, swollen glands, okay, glandular affections. Soric, where there is inflammatory conditions. So we saw that tonsillitis will be there, tracheitis, bronchitis. In these conditions, we think of laryngotracheobronchitis. We think of diphtherinum. So it has soric background. Tuberculous person who are prone to TB and having glandular swellings, muscle wasting, cachetic appearance. So tubercular person. So it is indicated to scrofular, glandular involvement, soric and tubercular persons who are prone to catarrhal affections of throat. So because of these miasms in the background, these patients are prone to catarrhal affections of the throat and respiratory mucous membrane. You can see the catarrhal affections of the throat and the respiratory organs. The mucous membrane of the respiratory tract is usually affected. Persons are very weak and exhausted vitality. So the vitality of the person is weakened. The weakened vital force, exhausted vitality. Because the vital force or the vitality of the person is weakened, it is making him extremely susceptible to the diphtheritic virus. Once the person becomes weakened, if the immunity or the vitality of the person is lowered, once the vitality is lower, it will make the patient susceptible or prone. It will make the patient prone to diphtheritic affections. It will be susceptible to the diphtheritic virus producing diphtheria and various other clinical manifestations which we read earlier. So we know the constitution now. Scrofulous, tubercular, soric person who is prone to catarrhal affections of the throat and the respiratory mucous membrane. The person is weak, he is exhausted, vitality is completely exhausted. Hence, he is extremely susceptible to the diphtheritic virus. The diathesis, it is adapted to strumous diathesis. So now another new word comes up, strumous diathesis. If there is scrofulous diathesis, there is a glandular involvement, and in strumous the glands are swollen in cases of scrofulous, whereas in strumous there is thyroid gland swollen. Thyroid swelling occurs. Okay, the thyroid is swollen in cases of strumous diathesis. So the diphtherinum is adapted to strumous diathesis. Moving further to the guiding symptoms of this drug. When the patient from the beginning seems doomed and most carefully selected remedy failed to relieve or permanently improve Okay, when you give the best selected simulacrum to the patient, when the carefully and best selected remedy is failing to give any relief to the patient, or it is not improving the condition of the patient, then we can think of diptherinum. In cases of diphtheria, when the patient is very doomed, okay, generally the patient is doomed, sad, okay, when the patient is doomed, completely overwhelmed, he is sad and doomed, and when the carefully selected remedy is failing to give any relief, or it is failing to improve the patient permanently, then we can think of the diphtherium. Okay, in diphtheria, when the attacks from the onset tends to malignancy, right from the onset, usually what happens, the onset occurs, and from the prolonged period, if it is left untreated, many cases will turn into malignancy. After a prolonged period, they turn into malignancy. Whereas in diphtherium, what happens, right from the onset, the cases are going towards the malignancy. Malignancy is nothing but the cancerous condition. The diphtheria is indicated when the attacks from the onset, they are progressing towards malignancy. Other remedies are lacaninum, mercurius, and cyclamen. Painless diphtheria, very important. How is the diphtheria in the patient? Diphtheria is painless, where the symptoms almost or entirely are just objective. So what do you mean by objective? Objective symptoms is what the observer can see or the physician detects. Okay, so the symptoms are objective. What are the subjective symptoms? Subjective symptoms are those what the patient can feel. Now, since the diphtherium is painless, there is absence of the subjective symptoms, and the symptoms are just objective, what the observer can see. He can see a false membrane in the throat, and the diphtheria is completely painless. Patient is too weak. How is the character of the patient now? He is too weak. We saw the patient is doomed, he is exhausted, apathetic, uninterested. He is apathetic, uninterested in what's going on in and around him. He is too prostrated, completely weakened to complain. He can't even complain to people. He is too prostrated to complain. Stupor, but easily aroused when spoken to. Like in baptisia and sulfur, you can see the patient is in a stuporous condition. But he gets awakened on easily and answers. He gets awakened easily and answers when questioned. When spoken to, he gets aroused. Clear, guys? Epistaxis or profound prostration, even collapse may occur at the very beginning. So the collapse, profound prostration, epistaxis, from the very beginning the patient goes into collapse. From the very onset the condition progresses into malignancy. The pulse become weak, it is rapid, and the vital reaction is very slow. We know the vitality is lowered, and the pulse is weak and rapid pulse. Diphtheritic membrane is thick, dark, grey or brownish black. You can see in the picture here, the diphtheritic membrane, it is thick, it is dark and brownish black, it is grey or brownish black. The temperature is almost low or subnormal. The temperature, there might not be shooting fever. The temperature could be subnormal or low. But the pulse is very weak and rapid. Extremities are cold with a marked debility, marked exhaustion. You can see the exhaustion and weakness very marked in cases of diphtheria. Patient lies in a semi-stupid condition. We saw stuporous condition, the patient lies. The eyes will become very dull and besotted. Just like in drunkards, you can see those besotted eyes, very dull eyes, or the dull eyes after a prolonged usage of the eyes. How do the eyes look? Very dull, besotted. So similar eye appearance can be seen in cases of diphtherium. How is the diphtheritic membrane? It is thick, it is dark, grey or brownish black. Temperature, how is the temperature? temperature, it could be low or subnormal. Pulse, weak and rapid. Extremities will be cold. There is debility. Patient will lie in a semi-stuporous condition and the eyes look besotted and dull. Other remedies are Apis and Baptisia, where the patient lies in a semi-stuporous condition and the eyes are very dull. The dark red swelling of the tonsils and palatine arches, parotid glands, cervical glands are swollen. You can see in the picture here dark red swelling of the tonsils. We saw it is a strumous diathesis. Because of the strumous diathesis, you can have an idea that the tonsils are going to be swollen. They are dark red in color. Just like their tongue is going to be dark red with a light coating. Similarly, the tonsils are also going to be dark red in color. The tonsils are dark red in color, and we have the palatine arches which are also dark red. You can see the palatine arch dark red. Parotid glands, cervical glands will also be swollen. They are greatly swollen. Because of the scrofulous diatheses, the cervical glands, parotid glands are also greatly swollen. Discharges from the throat, nose, mouth are offensive. So in diphtherium, the discharges are going to be offensive. Offensive discharges from the throat, from the nose, mouth. You can see the discharges from the nose, the discharges from the mouth, the throat are going to be extremely offensive. Tongue is swollen red, very red. You can see the picture here. The tongue is swollen and it has become very red with a little coating. You can just see a little coating here. The tongue is going to be a little coated, but it is very red. Okay, it is very red. Swollen glands without pain. We also have the glands which are swollen without pain. We have the diphtheria which is painless. Now we see the swallows without pain. Even the swallowing, since the glands are painless, the swelling is painless, so the swallowing also is going to be painless, but the fluids are vomited or returned by the nose. But once the patient, since there is a diphtheritic membrane formation there, it is obstructing the passage of swallowing. It is not able to the patient is not able to swallow. Since the swallowing is obstructed, the fluid will be returned or it is vomited through the nose. Either it will be vomited out or the fluid will be returned through the nose. There are two passages: vomit or it will return by the nose. Dark thick grey membrane on tonsils, on the left tonsils especially, dark thick grey membrane. There could be a dark thick greyish membrane on the tonsils. Grey membrane could be present on the tonsils, and we see further symptoms that they have obstinate tonsils, the tonsils which don't get cured easily. They are obstinate, stubborn tonsils. They don't get relieved quickly. Relapsing diphtheria, the diphtheria keeps relapsing over and over. The patient wants cold air down the throat and he craves for the cold drinks. He wants cold air, cold drinks. Okay, fine. We saw obstinate tonsillitis. Patient wants cold air down the throat and craves for the cold drinks. Moving further to the mental symptoms, we have only two mental symptoms stated in our books. So we have carpology. Carpology is where the patient in the delirious condition, he will pick the bedclothes. Picking of the bedclothes is done, which is nothing but the carpology. Sees imaginary objects. The patient sees the imaginary objects. You can see he will see the imaginary objects. So this is all about diphtherium. We can just have a quick revision. So what did we see, guys? It is a nosode. It is indicated in all these conditions. You can just see the picture: diphtheria, croup, myelitis, tonsillitis, epistaxis. And what is the constitution? Strumous, scrofular, tubercular constitution, soric. And diathesis is strumous. Person is weak, he is exhausted, the vitality is lowered, making him susceptible to the diphtheritic virus. And where does it affect? It affects the throat and respiratory mucous membrane, produces catarrhal affection. Acting on the throat and respiratory membrane, what does it do? It produces a catarrhal condition. Moving further, the patient is doomed. When the well selected remedies fail, we have to think of diphtherinum. And attacks from the onset itself, they will progress towards malignancy. They have diphtheria, which is painless. The patient will be lying in a stupidous condition. He is apathetic, he is prostrated, but when you arouse him, he will speak to you. Epistaxis, and there will be profound prostration, collapse. From the very beginning itself, the patient collapses, there is prostration, epistaxis, pulse is weak, rapid, vitality is lowered. The diphtheritic membrane, how is the membrane? Dark, grey, brownish, black, and the tonsils are swollen. They are dark red, and there is dark red swelling of the palatine arches as well. Parotid cervical glands are swollen, and the patient, when he lies in a stuporous condition, they also have the dull eyes, besotted eyes. There is debility. Discharges will be offensive. Tongue is very red and swollen. Very little coating will be there. The swallowing is without any pain, they will swallow, yet it is returned by vomiting or by running nose, or through the nose it will be returned. Next, we have throat symptoms, relapsing diphtheria, obstinate tonsils, dark thick grey membrane. The patient wants cold air, and he craves for the cold drinks. Mind carpology. What is carpology? Carpology is when the patient picks the bedclothes or the clothes in the delirious state, and he sees the imaginary objects. So this is all about the diphtherinum. I hope everything is clear. If you have any doubts, feel free to put them down in the comment section, and if you like the video, hit the like button and subscribe.